I think that's pretty subjective because some people like to be going out and doing things. If you can't do that, you can still get satisfaction from things. Maybe it's conversation, maybe it's reading. So you can still have some enjoyment in life. But it's important to feel that you're with people who have empathy for you, they care about you, they make an effort while they're with you to keep you comfortable, to keep you entertained.
Sure.
Make sure you have something to think about other than your health problems.
Or your current situation, right?
Well, she's very empathetic. She's very much engaged with the patient, constantly talks to the patient. Some caregivers, they do their job and that's it, nothing beyond the official job. But she takes an interest in keeping the patient entertained. They laugh, they have fun. So she's actively involved in the patient's life for the time that she's here. Well, there are a lot of details that have to be taken care of in caretaking, and this varies for each patient depending on how much family support they have. Assuming that the patient is bedridden and can't do much for themselves, is there somebody in charge of making sure there's food in the house, for example? Sometimes it might not be clear who's supposed to be doing the shopping. Issues like exercise, sometimes there's physical therapy and you're supposed to do that on your own. Some caregivers pursue that, others let it slide. So there's some areas of responsibility that are not necessarily all that defined.
Got it.
And so, you need to be clear on who is going to do what.
Who's doing what?
Well, my role, first of all, is to visit the patient, to spend time with the patient. As far as working with the caregivers, anything I can do to help or facilitate. So I'll go food shopping if I know that we're short on certain things. I can pick up medication if necessary. Whatever needs to be done. Anything breaks in the house, I don't expect the caregivers to be fixing things in the house. So I do that, but just whatever needs to be done that'll improve the quality of life for the patient and also the people who help the patient. Well, first of all, you don't want the patient to get COVID, and the patient can't travel to a clinic to get a shot. So if she gets vaccinated, the vaccine has to come here. The caregivers have to be aware of COVID also. One of the caregivers recently had to take 2 weeks off and go into quarantine because she felt that she might have been exposed. So you risk losing your caregivers altogether for a period of time. Even if they haven't been diagnosed with it, but just the fact that they're at risk might cause downtime. And then you have to wear masks all the time, and it kind of muffles your voice. So the patient can't understand what you're saying, especially if she has some hearing difficulties anyway. And wearing masks and face guards create a little more distance between the patient and the caregiver. So it's all a challenge. Well, I think that the caregivers generally do a very good job, but I think it's important never to become complacent and think, well, we're doing good enough, so we don't need to improve anymore. I think it's always very important to continue to improve. And caregivers have to interact with each other, learn from each other. Now, they do write reports. I'm not sure how many people read the reports, but everybody should always be trying to learn and to upgrade their skills.